apart from being a physician assistant, I also am a certified athletic trainer. And apart from my role with Summit, I have another job that is almost as fun. I get to act as an ATC spotter, or also known as a concussion spotter, for college football. The job entails sitting up in the press box with a computer monitor. We've got access and control to all of the different camera angles during the game, the capability to rewind and stop and zoom in and out, and then communication with the sidelines and officials. I get to watch these games from a bird's eye view. It's been a lot of fun to play with the video equipment and have that nice, comfortable view of the game. My primary responsibility is to monitor and observe for unrecognized head injuries. Okay, so that entails being able to use the video equipment and confirm that there was actual contact with the head or neck, and then that the player is demonstrating symptoms, which classically is ataxia, discoordination, disequilibrium, things like that. Okay, pretty outward, obvious things. Okay, so for example, you've got maybe a quarterback that gets his bell rung, okay, and he gets up, and the next play he's lined up under the left tackle to take the next snap. Okay, that's a problem. Okay, or potentially you've got a safety that makes a hard tackle, and then maybe he's stumbling around on his feet and can't quite get to his position in time. And then if by any chance, and it is a rare occasion that these professional medical staffs don't notice these things, okay, my responsibility then is to notify the team or the staff on the sideline as well as the officials to ensure that that player is coming off of the field and undergoes an evaluation. Okay? But the question really is what happens in the scenario where it's not so outward and obvious? What happens if a receiver makes an excellent catch, hits his head on the ground, but he pops up, he can shake it off and jumps back in and he seems fine. He keeps playing and you don't really notice much. Okay, are we following this kid to class the next day? Does anybody watch him to see if he's staying awake in school? Is he commenting during the lectures? Is he able to socialize with his friends? Okay, is there any video replay of him struggling in class or having difficulties with tests and assignments? Is he struggling to maintain relationships with family and friends, getting anxious and irritable? Okay, does this person even know they've had a head injury? The Journal of the American Medical Association recently published an article, and they were studying CTE in contact sport athletes under the age of 30. Okay, if you're not familiar with what CTE is, that's chronic traumatic encephalopathy. That's a physical change to the brain tissue in response to injury or impact or damage. Okay, it's an insidious onset chronic injury. So they're looking at this in donors, because it's a post-mortem diagnosis. You really only see the pathology under a microscope. So post-mortem diagnosis, under 30 years old, contact sport athletes. Okay, they were able to report and diagnose 41% of these kids were showing pathology consistent with the CTE diagnosis. Okay, regardless of the pathology, all of the donors were showing clinical symptoms. Okay, cognitive and neurobehavioral symptoms were frequent among all of them. The most concerning thing here, though, was the most common cause of death. Number 1, suicide. Number 2, accidental overdose. Okay, and again, these are kids under 30 years old with a chronic condition, severe, significant, lasting effects of this. That makes me a little bit uncomfortable, mostly because I have kids myself. I have a son named Britton. He's on the far left there. This is one of his games over the summer playing baseball. And we experienced our first traumatic injury, and it happened to be a head injury. He was due up to bat for his team to start the inning. So while he's getting his gloves and his helmet and things on, his teammate that's hitting after him got out of the dugout first and was in the on-deck circle swinging and warming up. Okay, and the timing happened to be just so, and kids of this age get distracted. Okay, so as he was walking out of the dugout, his teammate took a full swing and the bat hit him square in the face. Okay, the physical trauma was extensive. It was a lot. As a parent, that's hard to see. He had one tooth completely extracted, multiple other teeth broken, had fractures of the upper and lower alveoli, severe lacerations across his face. This is a post-operative x-ray. He ended up in the operating room that night to stabilize all of that, and it was a lot. Naturally, the primary focus of the first 48 hours is to stabilize his physical condition. Once we felt comfortable with that and we were home and his face was mostly put back together, we started to notice the signs and symptoms of the underlying brain injury. And it was by far the more difficult part. Anxiety and depression, irritability, mood changes. Okay? My once active, crazy child that would not stop talking suddenly was reduced to being silent, sitting still, had no interest in the things that he typically loved to do. Okay? It was very difficult to see. Thankfully, he's well on his way to recovery now. He's still got a lot of work to do, but he's doing much better at this point. This was us just a couple weeks ago. And it's concerning because it's not always the blatant obvious things that we see. If you see him tomorrow, if you're coming to the barbecue tomorrow, they'll be up here, the family will be here with us, and you'll see him running around and acting like a 9-year-old. Like almost undoubtedly will be teasing his sister and probably bothering his parents far too often, like most 9-year-old kids would do. Okay, but what we'll never really see is what's happening under the surface. The Journal of Neurosurgery just recently evaluated pediatric patients with repetitive head injuries. And what was concerning here is with repetitive head injuries, the complaint of headache, the severity and the number and symptoms that come along with headache actually decreases. With increased head impacts, headaches go down, okay? What they did see, though, is that there is a very heavy symptom burden, but it's the cognitive, the sleep, and the neuropsychiatric symptoms, okay, which translates to difficulty at school, behavioral changes, anxiety, and depression. Okay? And then common with that other study is that these are common symptoms, okay, that we saw similar to the other study. The importance of that is that headache is what we know, that's what we're familiar with, that's what we can relate to. Okay, so if that's not part of the equation, then the patient and parents likely are less likely to have a complaint or an issue when speaking with their healthcare provider. Okay? And if they have less complaints, they don't have something to talk about, the index of suspicion for these things also goes down. So if the index of suspicion is down from the provider standpoint, then the likelihood that they have the proper intervention and treatment and care also goes down and increases the risk for CTE. Okay? Does anybody here feel like you've had a concussion at some point in your life? Diagnosed or not? Okay, I know a lot of them are not officially diagnosed. I had an incident with a hoverboard a couple of years ago, not a diagnosed concussion. We'll talk about that later. Okay, so how about anybody at your table? If you were to look at your table, does anybody at your table have a concussion? Anybody currently concussed? Okay. How would you know? What is it that you're looking for? Okay. This is a difficult problem. We should never leave anybody to be asking Google, is what I'm experiencing normal? Okay. And to be certain, Google is not a doctor. A doctor is a doctor. Okay. And in that case, you should probably talk to one. Okay. But I am confident that you all will see this. Now, what I do now is vastly different from what I was doing a few years ago, but the concern is the same, okay? A patient history of head injury is not going to be an uncommon thing. I'm confident you all will come across that. We've got a great group of people here in this room in many different backgrounds, different specialties, okay? That's funny. There's one more picture. But regardless of what you do, you will interact with these people, okay? So my experience with my son this summer really deepened my understanding and broadened my field of view for these traumatic head injuries of what the actual problem is. It may not always be a physical pain or a physical impairment, okay? So I encourage you to dig deeper. If you're anything like me, I am not an expert in the psyche of a 9-year-old. I learned very quickly. But if you are similar to me, then I challenge you. That's my challenge at this point, is to consider what else your patients might be struggling with, what else is involved with their condition, what resources they could benefit from, and how we can better take care of all of our patients. Thank you.